How do we diagnose and how do we test for inflammatory bowel disease? There are numerous tests, and I know a lot of you have probably undergone several of these tests already. So individuals will undergo these tests prior to their diagnosis, but also in their disease journey as well. Going through or having these tests will be able to tell you how active your disease is, where your disease is, are there any complications, and we can also monitor medication levels if you're on certain types of medication. So blood tests can be used to check for inflammation, infection, anemia, or nutritional deficiencies. They can also check for the amount of medication in your bloodstream and if your body has developed antibodies to medications. So our bodies, they might make antibodies because they don't recognize the drug. It's outside of us, it's inserted into us, and so they recognize them as foreign. And so antibodies are developed to protect us. So if you do develop antibodies to certain medications, you might have to switch those medications. But all of those tests are blood tests, so they are great resources to have and tell us what's going on for several different things. The next set of tests are stool tests. They can tell you if there's inflammation in the digestive tract. So you take there's a stool sample and it's called fecal calprotectin, and it will tell you if there's inflammation in your intestines. Now, they might also do other stool tests. Maybe they think that you have a different type of infection, C. difficile infection. You could have a parasitic infection. So there's other types of stool tests where you would collect a stool sample that could test for other organisms as well. Endoscopic procedures. These are really the gold standard to diagnose IBD. And they can be, so what an endoscopy is, so it can either be a gastroscopy or a colonoscopy. And what that does is they insert a flexible tube either through your mouth or up your anus, and it has a camera on it, it has a light on it, and you can see the inside of the digestive system. And what's good about this type of a procedure is that you can, the specialist can take a biopsy or a tissue sample to look at the cells under a microscope. So this is how IBD is generally diagnosed, but it also can be used at regular intervals in your disease journey as well. There are other imaging tests that you might have been exposed to already. One of the tests that we don't usually or don't frequently use, but you might see, is a barium X-ray. So this is where you will either drink a thick white chalky substance, or it will be inserted up your anus and rectum, and they will take X-rays to see if there's narrowing of the bowel or any complications. And another imaging test that's very novel and non-invasive is an intestinal ultrasound. So it is, for anyone that's had an ultrasound, it uses a probe, you put it on the surface of the skin. So this special ultrasound looks at the intestines, and it's actually done by gastroenterologists who have trained, taken extra training. So it's not done by radiologists, it's done at the bedside at your appointment with certain gastroenterologists. And it's nice because there's not a lot of preparation. You can just, show up to your appointment and you get your results right away. It's not readily available in Canada, so there are very few numbers of gastroenterologists in Canada who use intestinal ultrasound. But you never know. They're trying to increase the numbers of specialists who do use this technology. The other two tests, CT scan and MRI. So these are three-dimensional images that look at all layers of the intestinal wall, and they can see if there's complications related to your inflammatory bowel disease.